Hi, my name is KOgaba, and I'll be in charge of this presentation today. A project objective. The main objective of this project is to create an online portal that will allow our customers to have all the information at their fingertip and connect with our staffs. The portal will also be used by employees who support the customer so they could retrieve data and input customer information. The project team main aim is to deliver an end product that will be user-friendly and increase customer satisfaction. Project objective. Listed below are the project deliverable, which are patient registration portal, employee profile, secure online payment, processing system, appointment scheduling. The project is expected to be completed between 3 to 6 months and will provide all the listed deliverables. Project scope. The project will be using web and data server that will be housed within the company data center. Once the project is complete, the user should be able to perform the following function with the online portal. The function should be used by both employee and staff. Also, patients should not have access to employee-only content. They should be able to schedule appointment, chat online, update patients' records as needed, review and download medical records. Phases of the project. Here are the phases of the project. Our first phase will be the planning and budgeting. Phase 2 will be to install a network, racks, and cable. Phase 3, payment system vendor price quote should be acquired by then, and software configuration review. Hardware and software installation will fall under our phase 4. Portal testing and fixing of issue will be phase 5, and phase 6 will be public release of the portal. Quality planning. We will ensure that the project work is done in accordance with all available industrial and federal standards and practices. These regulations and law are important because it will affect the proper operation of the company in dealing with government agencies. Violation of any of the regulation listed below will cause the company to lose government agencies like Medicare and Medicaid. Some of the laws that we have to follow will be the False Claim Act, the STAC law, anti-kickback statute, and the HIPAA. Assign responsibility. Here you see listed here the responsibility that will be assigned and which of the project team member will be responsible for each of the taxes in the phases. So the project manager, for example, has a lot of responsibility, even though they're not going to be directly responsible for most of the tasks. They need to be either informed or will be accountable for all of the project activities. The instructor will have least involvement because all he needs is just the information. And then we have activity definition. Its activity definition table shows all the activity that will be done for each phase and the time frame it will take. The estimated time here, estimated completion is by day. For phase 1, the design plans for budget will take 3 days, and the longest phase will be the phase 2 and phase 3 because those phases require more work to be done. And here we have identified risk. Our main risk for this project is supply chain delay, inability to find payment processing vendor on time, electric power related issue, and record request issue. The risk that will have major impact on the project is the supply chain delay because the supply chain will affect us installing our data servers and web servers. Since we'll be using an in-house server, we need to get the hardware so we'll be able to install it, and a delay in supply will cause a delay on the project. Risk response. For respond to this risk, we have to send out price quote requests to multiple payment system provider. That way we're not just dealing with one payment provider. Create an in-house API that link direct to the our organization bank. Mm, In case we are not able to find a payment processing provider on time, we can use the API to process payment until we get a provider. Use local hardware vendor to avoid shipping delay or loss of package. So that falls on the supply chain again. If we use local vendor, we will have to deal with a supply chain. And then inspect data center before racks are installed to avoid wiring issue. So with the electric issue, if we inspect the data center before the installation of our racks, that will ensure that all wirings are running accordingly and there's no issue with it. Perform activity cost estimate. The online payment portal project that Pikes Peak Healthcare is undertaking will offer users a one-stop store for patients to get medical assistance, access medical record, and schedule appointment, and perform real-time communication with medical provider. Using the estimated activity cost table, we have estimated the budget for the project to be 60,000, which include a 12% project reserve fund. Below here, you see on the table, we show our calculation for the estimated activity cost. And we use the formula, standard formula used as A multiplied by B multiplied by C equals to D, where A is equals to the number of units per over hour per hour, B is equals to number of employee involved, and C is cost the over unit of per hour hourly rate, and D is the total amount. So the total project cost estimate, that's D. And for here we got 60,000 to be the total cost. Determine project budget. So the project budget here shows a more detailed breakdown of the actual amount that we'll be using for the entire project. And for this, the calculated budget for this project is $52,570. And so that's taking into not taking into account the reserve, 12% reserve, which we had earlier calculated. Aggregate total budgeted costs. The table here shows the aggregated cost of the project, and the aggregated budget cost is calculated by adding the total cost of each project work together using the 5-month estimated completion time. The aggregated cost is the concurrent cost of the whole project. The project aggregated total budget cost has been estimated to be $52,570. Determine actual cost. So the actual cost of the budget is still in line with the projected cost, which projected cost was 52,570, and from our calculation the actual cost will be about 52,570, and that's still leaving us with the 12% reserve, which will be $7,430. Recommendation for practice in future research. A project is going to add a great value to the organization because it will be used to address issues others in the health industry have failed to address. There were a lot of uncertainty that could have been detrimental to the work of the project team, but we were able to overcome them. Some of the uncertainty that we faced during the projects are supply chain delay, time zone difference, social and economical change. To ensure that our future projects are not affected by supply chain delay and economic change, the organization should ensure that all needed project resources are purchased and delivered, if possible, before the project is started. Although most would not see the benefit of this recommendation at the moment, I do believe that the company would be much more prepared to deal with any of these issues if the plan ahead. Conclusion. The project team members show confidence in their work and were able to were available at every turn to ensure that their work did not create risks for the project. Sometimes team members would have to work outside regular working hour of their time zone to make sure they are working on the same page with their coworker. Since this project was a success, there are no much changes that would have to be done with future projects of this nature. But the experience gained from here can still be used for future projects that involve innovative idea for the company. And below here is our reference, and this what we use for the research for this paper.